Hi everyone, so this is Christian. I'm presenting on translational research on autism and self-stimulatory behavior today. So the autism spectrum and individuals on the autism spectrum, we're all familiar, I believe, with individuals on the autism spectrum and the behaviors they present with. The behaviors I'm most interested in looking at today is self-stimulatory behavior. But other criteria associated with autism spectrum is communicative and social impairments, and that includes an inability to read social cues, perhaps a disinterest or aversion to social situations, and or an inability to maintain reciprocal social interactions. The incidence of autism. So when I was researching for this paper, I was very surprised to see that it had increased. I was still under the impression that we were at 1 in 88 individuals exhibiting symptoms of autism, and now it's increased to 1 in 68 individuals. I find this particularly troubling because the typical classroom today, the mainstream classroom, might have 30 to 40 students. So that might mean that 1 out of every 2 classroom, one child within the 2 classrooms or within a given set of 2 classrooms might be exhibiting symptoms of autism. Striking. So what do we mean by self-stimulatory behavior? So Kogel and colleagues listed a couple of behaviors that we might paint a picture of when we're looking at self-stimulatory behavior. And that includes eye crossing, finger manipulations or hand wringing, repetitive vocalizations, grimacing or other inappropriate facial expressions, hand flapping, mouthing objects, body rocking, teeth clicking or bruxism, tongue clicking or other tongue play, saliva play or saliva swishing was listed as well, head shaking, tensing one's whole body, tapping one's fingers or their whole hand against the body or objects. So why did we choose self-stimulatory behavior today? So the research states a clear connection between high rates of self-stimulatory behavior and lower rates of learning or attending to learning trials. This might be in direct interference with language acquisition type tasks and or with an individual's ability to perceive social bits in the environment. And as we know, and as was previously discussed, these are direct deficits in individuals diagnosed with autism, which is, again, language and social interaction. Kogel and Covert listed that this is difficult too, the high rates of self-stimulatory behavior, because an individual cannot attend to more than one stimuli at a time. So it's understood then that individuals engaging in self-stimulatory behavior may not be able to perceive discriminative stimuli that may be presented during learning trials. To further provide analogy for what it is that we're looking at here, Lovas and Kogel and other colleagues in 1973 provided a study where individuals with autism, children with autism, were put in a room full of toys, and it seemed that children with autism preferred to engage in self-stimulatory behavior rather than play with tangible toys. That's concerning. Also, Lovas in 1971 had mentioned and driven this point home that given the choice between contingent access to self-stimulation versus tangibles, children with autism would tend to choose opportunity to engage in behavior. So given the choice to select a reinforcer that they were working for, individuals might choose, for example, access to hand flapping versus access to a tangible item. Higher rates of learning occur when self-stimulation is used contingent on appropriate responding. So here we see the effects of this reinforcer. It is a very strong reinforcer, and those that have used it as a reinforcer have found it more effective than any other tangible. So it's a very strong reinforcer, high magnitude reinforcer. So how does this relate to translational research, and what's the idea proposed here for research? So it seems, we presented recently, or before, excuse me, given that it seems children with autism find it more reinforcing to engage in self-stimulatory behavior, it's proposed that one look to the literature regarding the measurement of the strength of reinforcers and how best to manipulate reinforcers decrease behavior and increase acquisition and social interests in individuals with autism. So since our main idea and our main concern is the strength of the reinforcement received, or the strength of the reinforcer, that is implicated by engaging in self-stimulatory behavior, it's important that we look to the functional analysis when we're looking at how strong these reinforcers are and how we're going to use those reinforcers to offset acquisition. So it would seem common practice and common knowledge that self-stimulatory behavior serves an automatic reinforcement or sensory reinforcement function. However, studies have shown otherwise. There was a study showing that the functional analysis determined a man's verbal perseverations were maintained by attention. A study by Mace, Browder, and Lynn showed that a child's stereotypy served an escape or avoidance function. So given that self-stimulatory behaviors seem to be in direct interference with functional or social skill acquisition, one must be sure to determine what type of reinforcement is serving the individual. It may not be automatic reinforcement at face value. This is an important first step. So how have we seen reinforcers or these types of reinforcers being manipulated? Sensory extinction was listed as the earliest type of manipulation with self-stimulatory behavior. And as we know, as practitioners in the field, it's difficult to really mask the effects of severe sensory behaviors, for example, like self-injurious behaviors. It's difficult to completely remove the reinforcer there. Response blocking or response interruption was also listed as a way to manipulate sensory reinforcement. Behavioral covariation was an interesting point by Lovaas and Simmons in 1965. And here, the idea was that one response may produce changes in a non-manipulated response, which an analogy here would be how self-stimulatory behavior or suppression of self-stimulatory behavior may offset an increase in social skills, in social interests, in mending rates, and other important skills that would be prudent for acquisition in individuals with autism. To support that, Berlin suggested that organisms seek out optimal levels of sensory stimulation. Decreasing self-stimulatory behavior may lead to an increase in play to satisfy need for sensory input. So we can use this to our advantage. The fact that suppression, again, or punishment perhaps, of sensory behaviors or sensory seeking behaviors may allow for opportunity for individuals with autism, or the subject that we're looking at, to seek out reinforcement or be open to reinforcement from other areas. The incidence of self-stimulatory behavior is functionally incompatible with certain appropriate behaviors, and this again shows that the reinforcement and the effort expended during engaging in the self-stimulatory behavior interferes with the individual's ability to be able to perceive reinforcement from other areas. So thus it's important to target self-stimulatory behaviors for decrease in order to increase appropriate attention to learning trials and social interaction. Excuse me. Excuse me. So what are the implications for research and practice? The main translational message here is that reinforcement encountered for engaging in self-stimulatory behavior can and should be manipulated in whatever manner deemed appropriate to alter the magnitude or incidence of the behavior. Future research may find it prudent to uncover what type of reinforcement is maintaining the incidence of self-stimulatory behavior in order to increase social interaction, social play, appropriate play, naturally occurring reinforcers, attention to tasks, and natural contingencies. And all of these areas, again, are important to the diagnostic criteria of autism in individuals with autism. And more importantly here, the reason I found this so valuable and this topic so valuable is just self-stimulatory behavior is whatever input they receive from it it's not observable, and therefore to us it seems to still be on the fringes of but there is still measurable and very simple ways that we can manipulate the reinforcement that they receive from it. Thank you so much. Thanks for your time.